Now today we are going to start the second part of the inicet November 2023 discussion, and in this way I will go at a much quicker pace rather than the speed that I adopted in the first part. So in this question, a 5-year-old 1 or 3 liter per minute wire nasal cannula, what is the appropriate FiO2? To see in this type of numerical questions, always remember that examiner is going to give you, in most of the cases, 90% of the cases, the middle two option would be correct. And when the middle two option would be correct, it is most likely that the lower variable is going to be correct. So when you are left with no ammunition, you can go for this approach. So what in this approach, what you will do, you will arrange the option in an ascending order, whatever the value they give. Like in this case, what we will do, 25, 30, 45, 60. Now in this case, always remember that examiner is not going to give the extreme numbers. They are more likely to give the middle numbers, because just by the law of averages, their main job is to confuse, and they will be successfully confusing you if the value is in between, because people will apply various types of concepts. So rarely the extreme would go right. So this is the approach that you can adopt. Now 1 to 2. So this is basically scaphoid abdomen. So the C would be the correct. This is case of congenital diaphragmatic hernia. Now for 103, remember that fibers of the internal oblique muscle and the transverse abdominis contribute to which boundaries? Now one thing here, shoulder, internal oblique and transverse abdominis, which definitely form the posterior wall. So we will see where there are 4. So only one option is eliminated. So we are now left with, okay, fine. Now we have these 3. Now let us see whether it forms anterior wall. Internal oblique will not be able to form the anterior wall, and especially the transversus abdominis will in all case will not be forming the anterior wall. So one is more likely to be wrong. So in this we will go with 2 and 4. Now we come on to the 104. In which of the following organisms genetic material is adenine not equal to thymine? See, this is possible in those which are single stranded or basically that of RNA, DNA are more likely to follow this. So we will go with the HIV retrovirus. Which of the following are responsible for increased blood volume during pregnancy? Now increased blood volume during pregnancy. So in this again, antidiuretic hormone aldosterone, what it will do, it will retain. So fine, and then the increased fluid retention by the kidney. So see, the aldosterone is the opposing, it is in this sodium would be going outwards. So again this will lead to volume depletion, so this option cannot be right. Again the action of estrogen and aldosterone, again this option cannot be right, so we are left with B option. Now we come on to the 106. Which of the following is a function of the marked layer? Okay, fine. See, even if you're not able to be, very rarely people would be able to identify that what which part of the body this is showing. So just go with the options. The options will tell you what the question is. So this is more likely telling us that this is adrenal gland. Now an adrenal gland, what it is saying, that is, see, they are themselves living, this is capsule, then this is the uppermost part. So outermost part is glomerulosa. So this is what, this is zona glomerulosa, and what will be, it will be responsible for aldosterone, so sodium and water retention. We will go with the B option. Now we go to 1.7 healthcare. See, this is a ratofy type of questions. See, how will you assess the quality of healthcare provided? You will know about the bar graph, you will know about the scatter graph. So, and again this is multiple logistic regression model. So if even it, see, I'm not saying that you should get this right, but if you were to apply tukka, so how can you apply? See, this is bar graph and scatter graph. These are quantitative things. Whenever we since class 10th we have been taught like how bar graph would show. Bar graph is essentially a quantitative instrument, and here we are talking about qualitative thing. So definitely bar graph will not be a very conducive thing. And then again we move on to scattergram again this will be related to mathematical. And then multiple logistic regression model, this complex name regression progression, these are again the name by name itself is showing that some deep mathematical computation is going, whereas the question is demanding that we are asking the qualitative things. So by that logic we can eliminate, and just because we know about these three we can tell that this may be the option. But if you are not getting this right, this okay. Next move on to the 108, which are the ATP binding cassette. This is a factual question. You can see here Virappan wearing a 90s cassette, in case a lot of you have been born in 2000 Gen Z, so you would not be knowing that cassette were very much popular during that time when Virappan was dominating in those areas. So ATP binding cassette associated with verapamil. A child with type 1 diabetes mellitus present with no blood sugar, what is the further management? See, in these cases, even if you know nothing about this, you can still, if you have good understanding, then you can always mark the answer right. See, first, what is the primary pathology in diabetic ketoacidosis? It is that there is volume depletion. So our first target would be to give the volume. So normal saline will definitely be given. So which option we will take? Cutaneous insulin, again this is an emergency situation, then why we should go for subcutaneous things? So again this would be out. Now again normal saline followed by insulin infusion after 1 hour, and normal saline and insulin infusion immediately. See, first we will be focusing on getting the volume right, because we will correct one thing at a time. So we will go for this, that is insulin infusion would start after an hour, just because after we infuse a bottle, then the patient volume will get repleted, and then insulin can be given. Again, 110 on the left hand graph, what of the following diagnosis can be inferred? See, in this question I will say that you don't know this see the graph also. If in respiratory system, if you are getting this question, if you are getting that the other three are of the same nature, they are restricted, so obviously answer would be D. Let us move on to patient who has rheumatoid arthritis or BP by local doctor who she stopped taking suddenly. See, in this hydrocortisone would be given. Many of you would have argument that why not IV saline or other things, because hydrocortisone will have multiple effects, and most importantly it has permissive action. This is given in Ganong. If we go through it, we will know that cortisol has a permissive action, so it facilitates the actions of the others. So therefore this holds of prime importance. Now we move on to the 112 transferrin. This is iron deficiency. Now again, a non-scarring alopecia. Which of the following causes non-scarring alopecia? Even if you don't know, never read about it, you know that frontal fibrosing alopecia. Here some scarring, fibrosing, then that means some scarring will happen. Scarring would happen, then this option goes out of the game. We are left with only B. So by that logic, you can reach the answer. Again, now profuse watery stool. This is see, in this tukka will depends upon you how your intuition is developed, because this is the case of pseudomembranous enterocolitis. Now pseudomembranous enterocolitis, now this holds no sense, because this is an antiviral. Cilastatin, this is dehydropeptidase inhibitors and all, that is given along with beta lactams classes of drugs. So again this would not be there. We are left with this option A or B. So by that, if you go for by 50-50, fidaxomicin is the correct answer. What is the most common hypercalcemia? See, what is the most common of hypercalcemia in this type of question? If you have to apply tukka, how will you apply? You will apply by understanding that malignancy is the most common thing. Neither hyperprotein, nobody is getting vitamin D. Yes, everybody is deficient in vitamin D. The present lifestyle is as such. So by that logic, we can eliminate that. Again, parathyroid adenoma. How many of cases have you seen of parathyroid adenoma, or how many of you heard, or parathyroid hyperplasia for that? But malignancy is a very common thing, and you have always seen that in malignancy, many people are suffering, and in much of the malignancy case, hypercalcemia is possible, and that's what we study in metastatic calcification. So therefore, by just knowing, just you have to apply your presence of mind that okay fine, this is the most common disease that I am seeing all around, so I will take this option. Mood stabilizer causing hepatotoxicity and hyperammonemia. See, this is again tricky type of question, and it entirely depends upon, you can leave also, but valproate is the answer, because all all the other drugs are hepatotoxic in nature. But this is a factual question, I don't think that much of can be applied here. Again 117. Now 117, again you don't need to see the question here, this is also redundant. Once see, because you know that gluteus superior gluteus, gluteus medius, gluteus minimus is the nerve, whatever this is the odd one out, sciatic nerve, because superior gluteal nerve would be supplying the gluteus medius and gluteus minimus. Now on the 18th, okay fine, see, herpes simplex, okay fine, painful genital ulcers, in which you will see, have you ever heard in CMV that there will be painful genital ulcers? No. Human papilloma virus, I don't think that we see the condyloma acuminata, but ulcers we don't see. Varicella zoster virus, do you see ulcers? We should know. We see what we see. We see macule, vesicle, pustules, and kind of those features. So I don't think that the other options do not hold any water. So we will go with the A option. 119. Again, yeah, here you are seeing that there is some sporangium type of structure. So just see what are the things that have sporangium type of structure. So rhinosporidiosis, post orchidectomy, rinky. This is factual question. Rinking is associated with testosterone, so Leydig cell tumor. Now again, this is question that many of you will be fogged on seeing the question and the option afterwards. So you know that this is sacrococcygeal teratoma. If because tell me the pathology that other pathology that you would think here, but just because we see the question and then our mind is fogged that what is it, what it can be, but just apply common sense. What is the structure that you see here? It is the sacrococcygeal teratoma is most likely the structure that you are going to see. So they are saying to tell us the incorrect one. Now I have told you that by seeing you can tell that this is teratoma, and by the name you can reach to the answers. It is a benign tumor of coccyx. It is a teratoma. Fine. This option is right. It contains skin, cartilage, bone. Right. It can contain. It occurs due to defective migration of primordial cells to the genital ridge. It occurs due to the persistence of precaudal plate. Even if you know that precaudal is associated with buccal or mucosal membrane. So precaudal is something here that is in the mouth. So how come this precaudal will be doing something here? So by that, if you only have the rough understanding, fine, precaudal plate is associated with mouth, or even if you don't know that, you know that it occurs due to defective migration of primordial cells to the genital ridge. No big deal, primordial cells can migrate to the genital ridge, but persistence of this is a more an objective thing. I have repeatedly told you that examiner would make the more objective statement false. So therefore here the option A would be a wrong wrong statement, and therefore the right answer. 122. Identify the arrow mark. See, first one should understand that where is this picture has been taken from, whether we are seeing from the below or from the top. So this is, we know that this is artery. This cannot be IVC. IVC will come out from the liver, and this is liver. And liver aorta is on what? Left side. Liver is on right side. This thing is clear now. Now just join. You see now this will and you are standing where? You are seeing from below. Now this is what we are saying, that this is the left side, and we are seeing this from the below. So from the left side this would be connecting, and ultimately we know that these are the two aorta related things, and in between we have what? We have the pulmonary trunk. Now match the how will you remember this? This you will have to remember the whole table, and just by remembering that table you can come on to the answer. This is a factual question, nobody can have. Now 124 out of the 4, which is true about coughing? Forceful expiration against closed glottis. Fine. Forceful expiration against closed glottis, this is the physiological process. Slow expiration against open glottis. No. Why? Coughing, it is the slow respiration against expiration, that is the normal respiration occurring. It cannot be the answer. Begins with a shallow inspiration. Remove harmful sentences. This is also right. So 1 and 4 are correct. So this is the option. Now we move on to the blood investigation of what is the probable diagnosis. See, this is the serology of hepatitis B virus, and many of the people are confused regarding how to name, how to remember. So in this you can, it's not very clean morbid mnemonic, but you can remember. Now per vaginum is associated with as, so per vaginum is near the asshole. So by that you can remember. Now in this you can remember that per vaginum ASS it is associated with. Now when it is associated with, that is post vaccination is associated with anti-HBS. So by that we can eliminate what? That is anti-HBS is non-reactive, so it is not the post vaccination thing. So this option goes out, because this is the only option that would be confusing. Now this would chronic HBV infection, inactive carrier. If there is a chronic HBV infection, then HBs AG should be positive. Then therefore again this goes out. Again HBV infection in the window period. Now in the window period, what you do? In window period you see the outside world. So what we have here in this IgM anti-HBC would be positive, but here it is non-reactive. So again this goes out of the game. This is the right answer. Now we move on to the one distance. This was a googly kind of question because people are used to coins, but see the thickness. Once you understand the thickness, then automatically you would come to the conclusion that it is a button battery. Now cytochrome utilizes which of the following cofactors during the phase 1 of the detoxification reaction? Okay, fine. This is a much controversial thing, and people are not able to really understand, but I will try to explain it to you. See, what is gain of hydrogen? Now gain of hydrogen is reduction. So what happens in genobiotics is that CH is converted to COH. That is basically the hydroxylation reaction. Now when this is converted, so this is converted with the help of NADPH. This is this I mean there is no such tukka that you can apply. You will have to know the facts to reach to the answer. Again, now what is the role of the marx structure? Just have to know one thing, that this is thalamus. So either here subthalamic nucleus, and subthalamic nucleus is associated with motor function. Now again this is a good question where people in fact knowing the answer would get it wrong. So patient with history of consumption on 2 to 3 days right upper quadrant discomfort, he has grade 2 statosis, his BMI was this was, what would you advise him? See, lifestyle modification and weight loss, fine, we can advise him. Ursodeoxycholic and lifestyle modification, see, this will be a much harder, because is he having high bile salts? No, bile salts is not high. So again we will not be adapting. And lifestyle modification, vitamin E, again this is we focused regarding weight loss. Pioglitazone, again this class of drug is it is associated with increased urinary bladder cancer and all, and again that is the oral hypoglycemic agent, and none of the history here gives us that he is diabetic. Just by eliminating out, you are reaching to the answer. And whenever some patient will come or some anybody asks in our near our locality, so what we will answer, we have first go for the conservative management. Now we if some friend asks us on phone, what we do, we first advise him to go for the lifestyle modifications and weight loss. And if that after that also he is not able to improve, then we move towards the medicine part. So if that you have that much of medicinal application, that how do you apply in day-to-day life rather than cramming each and everything from the textbook. Now 130, biochemical psychology is used by in hybridoma technology. Now in hybridoma technology, see, one thing is that you have never read neither hybridoma technology, but you have read all these three, and then again you have not read this and antibody, monoclonal antibodies. So if you are not getting any way out, so just eliminate out what you know, and these three things you know, and this is one that you don't know, and this is the one that you don't know. Just connect both these two things. 31, again this thing, which of the following will be used in the treatment. See, if something is not contraindicated, then we can use each and every drug. Why to confuse a lot? Because examiner is there to save himself. He's not there to frame question for you. He's there to just get through this responsibility and prepare a decent paper in which there is minimum mistake. If the paper remain easy, it's okay, but there should not be any mistake, because it is a huge embarrassment in front of that board, and these are very senior professors who have very high kinds of ego and all. So if something goes wrong, then you can understand. You would be saying this, see, who are paper setters? Paper setters are those only people that are professors and that are in the top echelons of the of our medical institutes. These are the individuals that are involved in paper setting. So each one is carrying his own ego, and that gets reflected in the question paper, because there are somewhere from inside they are fearing that fine, we cannot take an aggressive stand on this, so therefore they would go conservatively. So they will at every point they would give you a hint to give you to get the right answer. Now non-ST elevation, again straight away they are saying that non-ST elevation, that what we are not giving alteplase, and rest all other thing we can give. There is no. 132, now consent. See, now this is a good mixture of forensic and gynae. So in this, what they're saying, consent. Now consent is taken for the things that are going to injure. If you are operating in fallopian tube area, and then you are taking consent that your brain will be injured, then it's a very nonsensical thing. Now how can your brain can be getting injured? So here what will happen? There can be bladder injury. We haven't heard hysterectomy, possible need for blood transfusion, not a big thing. It can be required. So, but bowel injury, this is something that is outside the operational field. So if that is getting injured, then that you would not have taken consent for this thing, and then you are in trouble. 133. Again, this is a dry drowning. Drought drowning is due to laryngospasm. See, dry itself speaks that there cannot be water, so automatically pulmonary edema, electrolyte, these goes out. What we are left with, A and B, if genuinely you think and rule out. So take your 50-50. If you are able to eliminate two options, then go for the question, and even if you are able to eliminate one option, then also go for the question, because there's no point losing in exams like inicet, where margin of error is small, and if you're not going to take the risk, anyhow you won't be getting selected. So take the risk and keep the finger crossed, maybe you would qualify. So again, this just PCO2 is high here, so and pH is high. So what we are sure that this is respiratory acidosis. We are left with these two options. So this is inadequate metabolic compensation. See, if there has been adequate metabolic compensation, then his pH would have been right, that is 7.4, but it is not so. So we don't need to see even the middle thing, that there is hypoventilation or hyperventilation. Just we go for this, and that is gone. That is correct. Now this is basal cell carcinoma, nothing Now will not show gastric acid secretion after the injection of pentagastrin. Pentagastrin, you should remember that when the parietal cells are damaged, that is pernicious anemia. Aspergillus candida cruzi fluconazole. See, this is a statement that should be crammed. It cannot be, I mean, very rare chance of using tukka. But you can remember by that a cruise ship will not fly. So definitely they will they are not going with each other. So there will be intrinsic resistance. Now 138. See, such types of bouncer would be there, but you will have to also, if you are going to attempt, just apply little bit of logic. What we are interested in infective endocarditis, we are interested that whether he is suffering from bacteremia, there is bacteremia in the wall of the heart or not. So how can we get that? Just by going at the wall. From we have no other method to take the sample from or take the culture samples. So we will have to go to the wall to prove that fine, this is infective endocarditis and we are dealing with this. So you will not see why you will be taking sample. It is not that the bacteria that is coming out, it is more in the atrium and then it is getting periphery, it is less in the periphery. If you are getting something in periphery, then obviously if you go at the center, there will be always the same concentration because mixing is happening very rapidly. So if you go in the inside the heart and then you just sample the walls, and from that you prove that fine, this person is suffering from infective endocarditis. Again, this is lateral plantar nerve. Nobody studies the soles, but then again, how can you get this answer correct? So lateral plantar nerve is analogous to what? One thing that you can appreciate here is that ductor hallucis, this will have the same nerve supply, and then see, abductor hallucis is one of our answer because it would definitely be providing the lateral plantar by the lateral plantar nerve. If you draw the foot, and remember that here median nerve supplies what? It supplies the abductor pollicis, flexor pollicis brevis, first lumbricals. So here median nerve would be supplying the abductor hallucis, first lumbrical, flexor hallucis brevis. So we are left with 2 and 5, and then the 2 and 5 are the correct answer. Just by relating, you can get this option right. Now we have 140. Now elderly was diagnosed with gallbladder polyp. Now gallbladder polyp, she has told us she has a which of the following is not a risk factor for gallbladder cancer. Again here examiner is playing reverse psychology. An elderly lady was diagnosed to have gallbladder polyp. She was told that she has a risk of gallbladder cancer. Who said? No, the examiner carefully never took the name that it was said by a doctor or somebody else. So don't take that statement at face value. So which is not a risk factor again. So porcelain gallbladder, it is again irritating in the gallbladder wall. Sclerosing cholangitis, again gallstone, these are all irritating the mucosa of gallbladder, but this is a single polyp would not be irritating the membrane, and therefore this would be the right answer. Now we move on to the campaign. She comes to what you did for her next DMPA. What should be advised to her? And see, in these cases, would you want any unwanted pregnancy to a person, because it has a lot of social ramifications. So just think on that line, that fine, if somebody has come and she have missed the periods and you are in a fix that what to do, then better go for it is the safest option. I mean, all the thing. This is the first step that you can. If something is non-emergency, then obviously this option will always take a front seat. So do the UPT and before taking the DMPA. See, the given examiner shows the effect of the PTH on blood and calcium phospholipid in an experimental animal. How does PTH increases plasma calcium level? How will PTH increase the plasma calcium level? PTH would, by increasing the, what does PTH do? What does in this question, it is not that they have given some data and the basic physiology would change. PTH does this thing that it promotes the osteoblastic activity. So it will promote the osteoblastic activity. Okay, fine. And also they are saying that decreasing renal excretion of calcium. So again, this is an examiner, that's why I have written fearful examiner. That why? Because he is if in any research anywhere in the world it is proved that decreasing renal water excretion of calcium, renal excretion of calcium is decreased, if it is proved in any of the study, and if the examiner marks C option right, then this question will fall flat. So examiner is taking the contingency that is not for today but for future also. One might be like till the copy is being checked or something is happening or XYZ, that in future this can be proved. Then people may go in the past and say that this was a wrong answer. Students who are very intelligent, they would not have got that right. So people will come with n number of excuses. So to avoid that type of controversy, they will have a very positive statement that encompasses all other everything. So just understand what he is doing. So the option D would be right. Cadaveric spasm, and again this is factual things. If some traumatic asphyxia, if somebody is burking you or somebody is jumping on your chest, even if you get these spasms, then this spasm will get vanish. If somebody jumps on up and down, then that traumatic asphyxia, how can there can be a spasm? For the spasm to persist, there should not be an external force applied. This is Newton's first law. So just relate and you will get your options right. Now 144. History of attack, fever, okay, fine. Now this is a very good question, but if you have your basic side, don't mug up the values. Focus on that. What is bacteria? Bacteria refers to the acute inflammation. Acute inflammation would have neutrophils. TB is a chronic inflammation. Chronic inflammation will bring chronic, long-term inflammatory cells that we see, and that is basically lymphocytes. So if here he is saying lymphocyte, then we definitely go for the tubercular. These are that is going to be holding prime importance. In 145, 9-month-old with child is brought to PSC with she is feeding well, spread 48. See, there are, what is saying was is no chest in drawing is seen, so there is no danger signs. There is nothing that is alarming. So why will you refer to the above if she can be treated? There is a patient would not be unnecessarily referred because it involves huge loss of livelihood, daily income, that to the poorest section of the society. So we will explain fine. This is if this thing persists and something happens, then you can come later onwards. Now 146. You have to know IMVJ. So this is that thing only. Now again, this in quantitative question, I have said that you should arrange it in the ascending order and then apply the second lowest, but that would fall flat on this. It's just because the examiner is playing safe. See, if in all of the option, one thing is clear, that the highest will definitely involve desferrioxide. So he is going, okay, fine. Just think in another way. that if you have marked the 400 microgram, and if again that is proven somewhere that okay fine, we need not apply at 400 microgram, so examiner is playing safe, so fine, I will take the extremmost option, and that's it. Now I'll move on to the next. Again, this is pica, posterior inferior cerebral artery. This is a regulation question. Now again, this is intrafusal fiber. Intrafusal fiber have gamma. 3-point bony relation. See, a relation between three would be there when the three would remain as it is. See, supracondylar fracture is here. So condyles is remaining. If condyles is remaining, then the three body relationship would be there. Fine. So answer would be A, because in all other option there would be some kind of fracture happening. Now palliative care. Now disease is the center of concern. No, never. In our clinical practice, patient is the center. If patient, Steve Jobs said he was suffering from pancreatic cancer, he said that he would adopt a traditional naturopathy based approach for the treatment of pancreatic cancer, and that was against all belief and everything, because that in terms of English medicines. So still he adopted that thing, and unfortunately he died. So if the care would have been disease centric, then in spite of her will, we would have gone and tried to treat the disease, that is remove the pancreatic cancer. But in this case we have not gone, because ultimately it's democracy. It's everything boils down to your individual choice. So having basic surrounding knowledge will also help in solving this question. So disease is the center of concern. No, this is wrong. Patient is sovereign. Always patient is sovereign. Death should neither be prolonged nor hastened. Then this is a very funny option. If that death should neither be prolonged nor hastened, then all the hospitals in this everybody all around the country or everywhere in the world, whoever gets cancer, he should not be admitted, he should not be given any kind of treatment. Why? Because we would neither be prolonging his life nor hastening his death. But again, this is a very comic statement if you extrapolate it. The aim is to improve the quality of life. Definitely everything we do in our surrounding, the aim is to improve the quality of life. The intention is to cure. Now this is a tricky option. The intention is definitely to cure, but cure the disease or cure the patient, there are two things. Imperative to do something, then passively observe. No, this is something that, so B and D is correct. Fine, we are left with these options. Okay, fine. A and B are already out of the game. We get C. Now this is a factual thing. Listeria monocytogenes. Again, this is of something factual thing. Now this is efferent to which nucleus of the thalamus. See, these are the fornicles fibers. These are, and this will go into the anterior nucleus. This is a factual question. Not much logic can be applied. Now 155, this is again a factual question, methadone. 156, pneumoperitoneal bradycardia. For this you have to know the basic pathophysiology. So when the air is filled, so what happens? It will stretch, the peritoneal stretching. That would be most logical answer. And also see now that air embolism, if air embolism was happening cause of bradycardia, then they would have taught us. They teach embolism not in very much in first year, but in second year, and they taught in coagulation chapter or DIC or in those chapters where the patient tend to be more serious. So now again, vascular injury, it is happening every time. So that means bradycardia will happen. Vascular, if you are going and dissecting something out, there would be some kind of injury somewhere. So that doesn't mean that heart will stop having bradycardia. Decreased afterload. Why will there be decreased afterload? Are the peripheral vessels being dilated? No. So even if you don't know that okay fine, peritoneal stretching is not there, then also you can reach to the answer by eliminating the others. Now corrugated plaque on tongue. Now tongue, this is tricky question. Epstein Barr virus is the thing. Requires the reverse transcriptase in PCR. Reverse transcriptase RNA virus. RNA virus, which is our respiratory syncytial virus. Which of the following is not required to consider grievous hurt? This is something that we don't study in 320. 160. Highest level of community participation. Now, this is a tricky question again, because we tend to not read these portions, and again this is much more commonsensical, so we avoid reading because we have to read much more important topics. So but if we apply logic, then we can also eliminate the options. Now, highest level of community participation, considering their ideas, will we just ask the community, okay fine, what is your idea? Okay, you want this type of village, but later you apply your what. This is what have been happening till now, from independence till now, that local village leadership have a different aim, like building some small dams, but the higher bureaucratic authority, they will have another vision. So there is no participation happening, community participation, it is top down. So again, there would be, we are not, this will not be the highest level of participation. Felt needs of the community considered, that is, you are keeping yourself at the higher pedestal. When you say that you are going to do this for them, so that means you are automatically putting yourself at a higher pedestal. And when you are putting at a highest pedestal, then how can be that the participation can be maximum only when both the agents come at the equal level and they exchange their ideas. So contribution of resources, again, resources already we are contributing. We see at the village levels, or everybody, people are giving taxes, they are contributing in form of resources, but yet that again, that would not be considered the highest participation. But now we come on to the last, involving planning of health related campaigns. That's what the government is aspiring, that when they say that give your ideas and we will implement this or implement that. So that is because once you are involved in this, then you are involved in every step. It's not only that in planning, you would be involved in planning, you would be involved in who gets the project, which contractor would do the project, and once you are living there, your interest is aligned with the interest of that area community. So you go and see that there is least corruption and all, and therefore this is the highest participation. Now again, 161, this is demo. 162 was brought after a fall. See, if somebody has fallen and he is 65-year-old, just what in first part I have said, that just repeat the thing. If you repeat the thing, you will know that if these things gets repeated, then it might be possible that the next time the patient won't survive. So I'm not saying that to apply complex curve criteria, because once you are in the examination, all curves goes out of the mind. Only right, left, or up and down, these are the orientations that are left in the brain. So when somebody is coming to you and they are saying that what you will do, just reimagine that if that thing was to happen again, will the patient survive? Will the patient be in a better state? So here obviously if second time falls happen, then most probably the old man will die. So we will admit it, definitely. We are not going to treat at home, we are not going to, because ultimately they are, up till now they were under the supervision of the household, because they were not able to control the diseases or look after the patient. Therefore they have come to the hospital, and therefore they would definitely be admitted. Now the point is that we will get more often wrong that, because most people will mark ceftriaxone, but in cases of fluoroquinolones, that in respiratory thing we use levofloxacin. So IV levofloxacin is used in respiratory infection. Fine. Now we move on to the next. Again, this is S-char. Now what will happen in S-char? What kind of S-char? We are left with 2, anthrax and scrub. So but remember that in scrub typhus there is renal failure, but in anthrax there is no renal failure. So it would be scrub typhus. Glycogen phosphorylase requires which of the following for its activation? Now how can something will be activation? Activation are basically by either this is an enzyme will not require another enzyme for its activation. It will require either substrate or Minerals. For minerals is here only calcium, so we'll go with the calcium. Kinase, this is an enzyme. How can one enzyme can stimulate another enzyme? If you see the immediate pathways, they are basically associated with vitamins and substrates and minerals, because that those are the things that would be progressing the reactions. 165. Again, this is again very common sense thing, that what do you study in blood? Okay, fine, we can blood n number of things. Muscles, again muscles, we have cells, we can do n number of things. Teeth is used in identification. We look for molars, premolars. Nail is the thing that if I give you, then will you be able to recognize? I don't think one can, because ultimately it is consisting of keratin, and we will not be able to much do DNA and all thing, because see, even if we come on to our own, then we may get the job done, but out of these all, nail is the very least likely. 166. Pre-contemplation phase, a person commencing morning walks due to their increased health benefit. Now, what is pre-contemplation? Like, pre-contemplation refers to before you are thinking, you are acting. Is it possible in our day-to-day life? Before we are thinking, we are acting. Then what the use of contemplation then? So again, this is entirely wrong. A person would think in the contemplation phase, not in the pre-contemplation phase. He would be in a very carefree environment. So statement 1 is wrong. So this and this goes out of the game. Now, contemplation, consider giving. Okay, fine. Contemplation, this is the statement seems to be right. Maintenance phase, 1 year back and has abstained from smoking ever since. Okay, fine. This is again looks right. A person who is overweight says he can't do anything as his entire family is overweight. This is something that is not a very positive statement. So again, for the C of the option. 167. Anxiety tachycardia result of 100 team of which the volunteer should run to evaluate the condition further. Resting pulse is 110 beats per minute is also, that is, there is increased thyroid hormone that is pointing towards Graves' disease. That is hyperthyroidism. It is pointing towards that. So what we will do? We will do the first step. TSH and free T4. 168. Carbazepine, oxcarbazepine, except carbazepine. Now, what was carbazepine seen with? Carbazepine have more rashes, fine, but oxcarbazepine have more of hyponatremia. So we will go with this option. Sodium transporters are seen in early part of the PCT. This is again a factual thing. You can always see. Now 170. Now 170 is that what is this is a very deep understanding kind of question. I don't think that any kind of tukka is applicable here. Unless you know the concept, you won't be able to get this question right. Just for the understanding, what is the Rini's test? That air conduction is better than bone conduction. So when it says Rini test is positive, that means we have to prove that air conduction is better than bone conduction. Is it happening here? No. Or it does. That is in this evaluation, after this evaluation, stepidotomy of the right ear was what might have been the tuning test results of the patient. So now stepidotomy is there. So air conduction has gone. So only bone conduction will remain. And only when bone conduction will remain, then Rini's test will be negative. So we are left with only A and B. Now what we will do? Now we know that he is having progressive bilateral hearing loss. So from that, answer would be between C and D. I am a little confused. I will later see and then tell. Stepidotomy of the right ear was planned. On neurological examination, a patient is not able to identify an object which is able to recognize you from time. See, this you have to rectify that. This is the inferior temporal lobe. 172. Delay the progression. If you have studied the heart failure, what are the drugs that can be improved to delay the progression? In that we have studied that captopril is the drug. So the following will delay the progression. that is the captopril. Now 173. Now 170 again factual question. Tipranwar. Fun fact is they have auction in pra thing has always bleeding thing. Prasugrel, it again increases the bleeding from the brain. Tipranavir, again it has pra, so it again increases bleeding from the brain. Now radial keratotomy, it was used to be done earlier, but now it is not done. 175 you can give a skip. 176 is simple understanding. What this is, head is associated with adolescents. Astigmatism does the child have? Now vertical, with the rule, vertical would be steep. So what happens is the ophthalmic found to have power of minus 1d spherical, that is if we plot the spherical lens, minus 1 minus 1. Now anyway minus 2 spherical at 180 degrees. So here what we will do, 180 degrees, so it will be at the power are at right, power is right angle to the axis of the cylindrical lens. So what will happen here? So minus 2 would be in the vertical 180 degree. What kind of astigmatism does the child have? So total, what if you draw, what will be there? Minus 3 minus 1. Now minus sign is associated with what? Is associated with myopia. In myopia we will use minus sign. So in this, minus 3 would be greater than minus 1, that is vertical is greater than horizontal, that is with the rule astigmatism. Again this is mucor. Moderate hearing loss, this is again something more of a English language kind of thing. See, they are saying, telling you percentage. Profound hearing loss, when you are losing 80%, then definitely that is profound. But will it be 80%, 80 decibel? What is the degree of hearing impairment? Severe hearing loss is greater than 70%. Now false. Profound hearing is greater than 80%. Moderately severe hearing loss is again less than 65. So that is the correct answer. Now again tall peak T waves, you will have to know this. This is fishnet pattern, dark and direct immunofluorescence in pemphigus vulgaris. Apocrine, see where the more of this apical part of the glands is released, it is in the axilla, apocrine axilla. Now we come on to the 182. Now 182 again we come on to the patient care. Like, see, if the patient presents in the earlier part of the surgery, then we are hopeful that earlier part of the cancer, then we are hopeful that we can save the patient. And now when we can save the patient, how can we save the patient? Is just by using surgery. After the surgery we will then adopt a aggressive approach, and then we will use the chemotherapy, exactly what we do in breast cancer. So first what we will do, we will do the debulking surgery followed by chemotherapy in the initial part of the cancer. But in the later half, when the cancer has spread, now you are more or less focused towards giving the palliative care, you are not much hopeful. So you are firstly looking for, okay fine, I should reduce the malignancy. So what we will do, we will give the chemotherapy. Now we will give the chemotherapy, and after that whatever remains, then we will take it out, and then we will see what happens. So this is the in the later part of the malignancy. So what will happen, first we will do the debulking surgery followed by chemotherapy. Again this is PIL, paraxial is associated with ribs. Dengue NS1 antigen is good argument, I think. We cannot do much thing here. Which of the following can be diabetic neuropathy? Again this is pregabalin. Which chelating agent is used in heavy metal poisoning? Not used. Again this is used in organophosphate poisoning, so this will not be used. Pollen leads to increased risk of borderline ovarian tumors. So what will be the answer? The answer would be low parity. We have studied that if there is less number of pregnancy, then there are the greater exposure to estrogen hormone, and estrogen hormone is a risk factor for breast cancer and ovarian. So that logic will apply here. baroreceptors, carotid sinus. Now carotid sinus, why they will be present in the deep smooth muscle layer? They have to take the pressure of inside. So inside pressure, where will it be taken? It would be best felt near the endothelium, that is in the adventitia layer, not in the deep inside the smooth muscle, where the muscles would also be compressing from outside, and then uh, that pressure will not be so efficiently sensed by the body. Again, this is by seeing you can say that they are seeing about proptosis. Again, 22 comes from emergency with the inversion of uterus during the pregnancy. See, what do we do in the inversion? Inversion, what we do? We try to reposition the uterus without removing the placenta, and then we will take the next step. Because if we don't do so, then the chances are that the patient may get into neurogenic shock and all. 192, again, this is oral lesions, physical suprabasal split. Again, this is why pemphigus vulgaris. Most important of breast carcinoma. See, most important prognostic, what we do is sentinel lymph node biopsy. On all those things we are concerned about. What we are concerned about, that axillary lymph node is palpable or not palpable. Our entire staging is dependent on that. So that would be the right answer. Vibrio cholera, we know that occludin is somewhat related with cholera. That is more than sufficient. Metabolic syndrome, here you need to know indeed that what are the criteria for metabolic syndrome, and that is hip circumference is not taken, that is the abdominal circumference that is taken. See, this is observational analytical longitudinal observation. This is longitudinal, is that something that you are taking a full video. When you are taking the photograph, then this is the case control. So case vaccine from L1 protein, tributary of the inferior vena cava. Now inferior vena cava, we know that left gonadal vein drains into renal vein, left suprarenal vein will again drain into renal vein, right ascending lumbar vein again will drain into the, it can drain on left inferior phrenic vein, again this will not be draining. So we are left with this only. Even if you have not studied that where does right ascending lumbar vein, one should have studied, because that is the draining thing of all those azagus and IVC. But even if you have missed this, if you know the other three, then also you can reach the answer. 50S chromosomes, that is linezolid. Least teratogenic effect. What are the least teratogenic effect? Again, a virus will have least in the virus that you have studied. You study like chicken pox. We study that there can be congenital varicella syndrome and all. Rubella, we study congenital rubellas, therefore we are giving vaccination. Cytomegala, we study congenital CMV, that is chorioretinitis and all. This is the thing, herpes simplex virus to see. Whenever examiner has to throw a trap, they will be very specific. Now, if they would have said HSV1, then this would have been a controversial answer. But again, they are saying HSV2, and HSV2 can be acquired only through when the baby passing through the genital tract. So, how come a thing that after delivery a baby would be exposed? Why would that haunt the baby? So definitely it would not be HSV. And that's it.